Beyond the indent. What sock marks can reveal about your health? We have all experienced it. The moment you peel off your socks at the end of a long day, only to find deep, lingering indentations around your ankles. For most, these marks are a minor annoyance or a sign of tight footwear. However, medical professionals warn that these seemingly harmless lines can sometimes serve as early indicators of how your body is managing fluids and circulation. Why do sock marks happen? In many cases, sock marks are a normal physiological response to your daily routine. Doctors point to several common, non-serious causes: lifestyle and posture. People who spend their days either sitting for long periods, sedentary jobs, or standing all day active roles are most susceptible. In both scenarios, gravity causes blood and fluids to pool in the lower extremities, a process known as dependent positioning. Dietary factors. A diet high in sodium can cause the body to retain water, leading to swelling in the legs and ankles. Hydration levels. Paradoxically, dehydration can also cause fluid imbalances that lead to leg swelling. Footwear fit. Sometimes, the simplest explanation is the correct one-year socks may simply be too tight. When to pay attention. Red flags, while occasional indentations are rarely a cause for alarm, certain patterns suggest that your body might be struggling to regulate fluid or blood flow. You should consult a healthcare professional if you notice any of the following. Asymmetry and progression. The human body generally thrives on symmetry. If sock marks appear only on one leg, or if one leg is significantly more swollen than the other, it is a signal that something is off. Similarly, if the marks are becoming progressively deeper or lasting longer over weeks and months, it warrants a medical evaluation. Accompanying physical symptoms, sock marks are particularly concerning when paired with persistent swelling that remains even after removing socks, hyperpigmentation, skin discoloration around the ankles, visible varicose veins, a heavy, aching, or fatigued sensation in the legs that only improves when the legs are elevated, serious underlying conditions in more severe instances. Chronic swelling and deep indentations can be symptoms of systemic issues, such as kidney disease or heart failure. In cases of heart failure, patients may also experience shortness of breath or difficulty breathing while lying flat. Note, while many fear blood clots, DVT, doctors note that clots typically present with intense pain, redness, and significant localized swelling, rather than just simple sock indentations. Proactive management and prevention. If your marks are caused by lifestyle factors rather than underlying disease, there are several ways to mitigate the swelling. Elevation. Periodically raising your legs above the level of your heart helps gravity move fluids back toward your torso. Compression therapy. For those in high activity or high sedentary roles, compression socks can be highly effective. They apply gentle pressure to prevent fluid from settling in the ankles, reducing the heavy leg feeling common in surgeons, retail workers, or frequent travelers. Lifestyle adjustments. Prioritizing regular exercise and a balanced, low-sodium diet can help regulate fluid retention. The bottom line, while sock marks are often just a byproduct of a long day, they are a useful diagnostic check-in. If the marks are asymmetrical, worsening, or accompanied by pain and shortness of breath, seek professional medical advice. Summary: sock marks are often caused by gravity, diet, or tight clothing, but they can also signal underlying issues like venous problems, kidney disease, or heart failure if they are asymmetrical or worsening. Monitoring these marks and practicing leg elevation or compression can help manage mild swelling, but persistent changes should always be evaluated by a doctor.